Hi, my name is Jones Muna. Today, we are looking at the nursing process. To begin with, the nursing process is a systematic, problem-solving approach used by nurses to provide patient-centered care. It is a framework that guides nurses in delivering high-quality care and helps them make clinical decisions based on critical thinking and evidence-based practice. The nursing process consists of 5 interconnected steps, namely, assessment, diagnosis, planning, implementation, and evaluation. The mnemonic ADPIE summarizes these steps. 1. Assessment. In this step, the nurse collects and analyzes data about the patient's health status, including physical, psychological, social, and environmental factors. The data can be gathered through interviews, physical examinations, laboratory tests, and other assessment tools. This step helps the nurse identify the patient's needs, problems, and strengths. 2. Diagnosis. The nursing diagnosis involves identifying and labeling the patient's actual or potential health problems. The nurse analyzes the data collected during the assessment phase to determine any deviations from the normal health status. Nursing diagnoses are distinct from medical diagnoses and focus on the patient's response to the health problem rather than the disease itself. They are formulated using standardized nursing diagnostic terminology, such as NANDAI, North American Nursing Diagnosis Association International, labels. 3. Planning. Once the nursing diagnoses are identified, the nurse collaborates with the patient, family, and healthcare team to develop a plan of care. This plan sets goals and establishes interventions to address the identified health problems. Goals are specific, measurable, achievable, realistic, and time-bound, SMART, and interventions are evidence-based actions aimed at promoting health, preventing illness, or managing the patient's health problems. 4. Implementation. In this step, the nurse puts the plan of care into action by performing the planned interventions. The nurse collaborates with the patient and the healthcare team to carry out the interventions effectively and safely. This step also involves monitoring the patient's response to the interventions, making any necessary adjustments, and providing education and support to promote self-care. 5. Evaluation. The final step of the nursing process involves determining the effectiveness of the care provided. The nurse assesses whether the goals have been met, whether the interventions were successful, and whether the patient's health status has improved. Evaluation helps the nurse identify any modifications needed in the plan of care and provides valuable feedback for future nursing practice. In summary, the nursing process is a dynamic and iterative process, meaning that it is continuously repeated and modified as the patient's condition changes. It ensures that nursing care is comprehensive, individualized, and evidence-based, promoting positive patient outcomes. Hence, the purpose of the nursing process is to establish a standard of care where nurses assess patients and create plans of action to address individualized patient needs. The nursing process has other purposes, as well, including but not limited to the following. Establishes plans to meet patient needs, guides nurses in the delivery of high-quality evidence-based care, protects nurses against potential legal problems, promotes a systematic approach to patient care that all members of the nursing team can follow. From me, Jones Muna, I say keep on studying.